Again, I'm really excited. I hope I'm doing you.
You're doing great. No.
So again, thank you for coming. Thank you, God, for allowing us to have this space to have a really cool conversation with a really cool person. Tracey is an anomaly because she comes from Western medicine as an OB practitioner, and then she worked in functional medicine for a really long time and got turned on. That's when she and I met. I was interviewing her on my podcast pretty regularly, and now she's actually back in Western medicine right now. So she is somebody that you might want to seek out if you are looking for more of a functional medicine approach but can't spend the $1,500 or the $3,000 in order to afford a practitioner like that. She would be somebody that you could see in office to get your questions answered. So she's really a very strong asset for you guys to have. So, okay, that's it, girl. Love you.
All right, love you too. All right, so my name is Tracey Sheedy. I have been a physician assistant since 1999, and I worked in a whole bunch of different places. I did some emergency room medicine, and then my real passion was really women's health, and I did it for about 20-something years. I did 16 years in New Milford. And then I took a little bit of a change because I got sick of, as Ashley talked about, really a pill for every ill, and I really felt like nobody was really addressing the root cause to why certain things were happening. And working for a corporation, I really had very limited resources because you could only see a patient for 10 minutes and kind of walk out the door. So you really can't get into what's going on with the patient and really get a good relationship with the patient. So for the last 4-5 years, I dove into the functional and integrative space where once you see it, you can't unsee it. Like you figure out like really how, like as Ashley was talking about, the detoxification pathways are super important. You don't even realize how important they are for your hormones. And you know, once your hormones are used, they have to be recycled and come out of your body. When they don't come out of your body, that's when cancers and stuff like that can wreak havoc to it.
We didn't even talk about
it. So that's like a whole nother talk, and I'm not going to talk about that today, but that's another topic for another time. So, you know, I just wanted to say there are myths about hormones that people don't think that they're that important, especially as we get older, but they're actually more important because, you know, whether it's cholesterol meds that are put on or there's things that mess them up, right? You have hormone disruptors, and I'm sure you haven't even gotten into that part of it yet. So that's another topic for another time. So I really got very into like really the root cause of why so many women and men, because I do see men for their hormones too. This is a little bit more towards women, but where they would come in and certain medical conditions, they were coming in, they were not just fatigue, but there was this joint pain, you know, the brain fog. I had a lot of gut issues that they would come in to me with, whether it was constipation or inflammatory bowel. Just never feeling well rested, sleep issues. The weight was always a huge topic that came on. So I dove into it, and so this presentation is going to be kind of a little bit light and funny. It's not a lot of slides. It's really kind of just, and it's really to open up a forum for you guys, for me to give you some information, and then for you guys to be able to ask me some questions, okay? So basically this presentation is really about like really, there is a menopause myth, okay, where, and I was at OBGYN, so I can say it, be given 10 minutes for a patient. When someone comes in complaining about all the things we talked about, insomnia, hot flashes, night sweats, decreased libido, joint pain, forgetfulness, I mean, I can just keep going on and on and on, they're very much dismissed, okay? They're dismissed and they're told to go on anti-anxiety meds, they're told, and listen, I was one of them that was told that. They're told that, you know, they're overwhelmed, it's just a part of life and you just have to deal with it. And that is just not true. So basically this topic is really mastering this midlife hormonal mayhem, and that's what it is. Like it's wreaking havoc. So a lot of you remember when we were teenagers and we had this up and down with our cycles and our emotions. The same thing happens when it goes out, right? And so the overwhelming feeling. So I just want to kind of address these topics. So, you know, it's a little bit funny, like welcome to the wild, weird and wacky worlds of menopause. You know, buckle up, it's going to be a hot, flashy ride, okay? Because it really is mother's way of saying, congratulations, you've unlocked a new chaotic level of life. And it's a time when your body pulls a dramatic exit on the hormones. So your hormones, you're not producing them anymore. And I talk about there's a biology to it, right? So, what menopause really is, I'll give you the brief medical term, is just like, it's a sensation of a period, but when that goes away, it means that we're not ovulating, we're not producing estrogen, we're not producing progesterone. We talk about testosterone, DHA, there's lots of other hormones besides just estrogen and progesterone. And you're really confused, sweating and uncomfortable, and really crying for no reason at all. So we said crying at dog food commercials because you could cry at the drop of a hat, okay? And this brings us right back to our teenage years. Like your mother would look at you funny and you'd start to cry. It's exactly the same thing. So as it goes in, it comes out almost the same way.
Oh, wonderful.
I know, right? Aren't we happy about that?
I'm not there yet, so wow, that's
But you know what? And I'm also going to preface this to saying, too, we think of menopause being only women in their 50s. It actually can happen 10 to 15 years before you even go through menopause. There are changes that are happening that nobody ever talks about, right? And if you go to your regular GYN, they'll sit there and say to you, nope, you're too young. You're 45, you're not even near it. You're 42, you're not even near it. It's untrue because your body starts to kind of like, there's a slow decline in it. And you start to feel those changes and you're on this roller coaster and you can have a period every single month and still be experiencing those changes. So some of the symptoms that we expect are hot flashes, and it's more like this internal heat flame, like a spontaneous human combustion. The night sweats, because waking up in a puddle of your own sweat is really very comfortable and super sexy too, right? When we wake up and there's sweat between your girls, that's great. And mood swings, because 1 minute you could be fine and be happy is everything, and then some old thing will just tick you off, and then you're plotting revenge on, the dog barking, the TV's too loud, or like you said, the microwave's beeps, okay? Those are the common things that you always hear about. So this is like a little thing, and this happens to a lot of women too, right? You're in a meeting, you're looking really professional, you're doing this great presentation, and then all of a sudden it's this internal heat comes on, like it is like a lava, and it's like a volcano, and you're sweating, and your upper lip is sweating, and you can feel it, and you're turning red, and you don't know what to do, and you want to get out of there. So now your anxiety goes up with it too, right? So when we talked about menopause versus puberty, it really is the ultimate face-off. In puberty, you have acne, mood swings, awkward growth spurts. In menopause, we get the wrinkles, the mood swings. We start to shrink, but we also start to grow around the midsection. And, this actually, like we talk about, it's puberty 2.0, but we have bills to pay, and actually, instead of being super skinny, we start to complain about and then we'll talk about the reason why this happens, okay? The symptoms you didn't expect and that nobody talks about really is this forgetfulness, right? It's like, if I don't have a sticky notepad on my desk at work for all the things that people ask me to do or my kids ask me to do, I'm not going to remember. We just don't. We forget why we went into a room or why we opened up the refrigerator, or you standing there going, okay, I'm cooking dinner. What am I supposed to be doing? So there's just this forgetfulness that happens. Random joint pain. I've had so many women come into me, frozen shoulders. They have a shoulder pain one day. The next day it's a hip pain. Then their toe hurts. Their knee hurts. It is all due to the lack of estrogen. Estrogen protects our joints. And as they start to decline, we start to feel those joint pains. And unexplained rage, right? So you could be completely fine. Your husband can chew too loud or breathe or do anything like that, and you want to put a pillow over his face because it just annoys you to your core, okay? So those are the things that we didn't have in puberty. So it is like puberty, but then you add all these things on top of it that doesn't make it much better, okay? So then this is I don't have hot flashes, I have short private vacations because you're always feeling hot on a tropical beach. And we hate summers because summer just we hate the winter because we're too cold, but then summer, you just feel gross and sweaty all the time because you just can't control your temperature. So again, you forget names, why you opened up the fridge. Sometimes you forget how old you are, but then you talk about the insomnia part of it because you'll remember everything. It's that 2 to 4 a.m. time frame where your eyes just pop open and everything that you needed to worry about and everything you're stressed out is running through your brain, and now you're not sleeping. okay? And then people will give you advice, and they don't really know what they're talking about. Like, have you tried yoga? You're just gonna make you hotter. Just drink more water, it's all in your head. And this is a big thing that I have a problem with, because these are a lot where, and because I've worked in the field, a lot of this is what you hear from the old-time docs, okay? It's just in your head, it's a natural progression. Suck it up, buttercup, you just gotta deal with it. And what I'm trying to tell you is that you don't have to do that, okay? Because really, these people should not survive very long, all right? So when you see that, ask for a smoking hot body, menopause was not what I had in mind, because we're always hot, but not in the fun sense. Okay, so some coping mechanisms that might work or not, you can pack your bra with some ice packs. You can, instead of screaming at everybody else, go in your room and scream into a pillow. Eating chocolate, because that just is going to make us feel better. It's going to increase some endorphins and make us feel better. We could all run away and have unlimited margaritas, but I don't know how realistic that really is. But there is a bright side to menopause, right? There is no more monthly periods. You don't have to worry about birth control anymore. And really, as we get older, there's an excuse to say whatever you want to say. So, but I thought this one was funny, because really there's only a pro of really no more periods. And as every woman that comes in to see me, and they're like, well, I just can't wait for it to end. And I always say, well, then the host of all other problems begin, and then we'll restart. Because they think that also once they stop getting their period, they're never going to have to go see me again. And then they come back like begging me to help them. So, the no more periods is the better fact of it. But all of these things, like itching, fatigue, tingling, the irritable bowel. I just saw a patient. Well, I was a little bit late because, she's in menopause, and all of a sudden, she's got this colitis that she never ever had. I see this a lot. Either it goes from constipation to all of a sudden now they have loose stools. So there's a lot of things that you don't realize your body's kind of going through, and it really is all related to this hormonal changes and shifts that's happening. Okay. I do talk a lot about hormone replacement therapy. There is a new theory about it, and there's these 2 books that I'll show you guys too that I really like to have patients read them when they start to argue with me about it. There really has been a paradigm of shifting, okay, especially in the functional and integrative space, is when we talked about longevity. It's almost malpractice to not discuss hormone replacement therapy with a female. And I'm going to bring this up to the men in the group. You guys go to your urologist. You have no energy, because I did work for neurology for a little bit. You have no energy, you have trouble with, ED or something like that. They're very quick to give you guys meds and to put you guys on testosterone. But when it comes to women, everybody doesn't want to talk about it. They kind of just say, it's a conversation that they don't want to have. Hormones are really not a bad thing, and we can get into the other stuff, the detox at another point, but they really are a game changer. And not only can they help with the hot flashes, the night sweats, and the mood swings, but they really do improve sleep. So I talk a lot about progesterone. Progesterone is this unforgotten hormone that is a neurosteroid. When I talk about being a neurosteroid, it crosses the blood-brain barrier, and it promotes GABA in our head. GABA is very, very important to stay asleep, okay? So when we don't have progesterone, and 100% of women that are going through menopause, your progesterone levels fall to 0, okay? There is no more. When you stop ovulating and you stop producing an egg, the time that your progesterone's high is right post-ovulation. When there is no egg fertilized, it's going to plummet, and that's why we get our periods. Some of you in this room, when we were pregnant, do you remember that feel-good feeling of progesterone, like in your second trimester, and I actually felt more even? That's when our progesterone is the highest. There's no anxiety. There's no feelings of overwhelmed. We sleep really good until the 3rd trimester. But progesterone really is that sleep and mood hormone. And a lot of times, it's just putting women on some progesterone, and literally it changes the way that they sleep and their moods. Okay, because it does potentiate GABA, so melatonin helps us fall asleep, but GABA helps us stay asleep. And so we don't have that ability. So that's why every postmenopausal or menopausal, perimenopausal woman I talk to, I'm like, how do you sleep? They're like, well, not good. I'm like, what, you're up between 2 and 4? And they're like, how did you know? Because it happens. It happens to all of us. It happened to myself until I started taking progesterone myself, okay? Then I sleep so much better. And when we talk about bone health, like I'm really, really passionate about bone health because once we also lose estrogen, estrogen protects our bones, our heart, and our brain. I did do 2 years in emergency room, and the amount of women that are in their late 50s to early 60s who are super active that fall and slip on the ice that we have here, or hanging curtains, or taking their dog for a walk, the hip fractures, the femur fractures, the wrist fractures are pretty high. And we can completely prevent this by going on hormone replacement therapy. There is no other medication that is better than estrogen for bone health, okay? So really, basically, like, I want you guys to understand this, and do not be afraid to talk to a healthcare professional about this. I am one of those healthcare professionals that I bring this up in my topics for women over the 40 all the time, and even when I see my male patients. But not everybody does it. I do it so that you don't have to feel that you have to bring up the topic. But don't be afraid, because it not only will help with the symptoms, but it's really going to enhance your lifespan and longevity. And we'll expound on that in a little bit. I'm going to tell you a little bit of joke about this part with the sex and menopause. My 13-year-old was helping me put this slideshow together. It's pretty funny. And I didn't know how to like put it together. And he was like, you know, like the young kids know how to do all this stuff. Right. And he looks at me and he goes, "Mom, what are the age brackets of these people that you're talking to?" And I was like, "I don't know, like my age, maybe a little younger, a little bit older." And he goes, "I really don't think you need to discuss that." And that's the stigmatism that you kind of get, right? So he looked at him and I'm like, "What are you talking about?" He goes, "I really don't think that you need to talk about that. That shouldn't be a topic that you guys talking about." So he was basically saying that we shouldn't be having sex anymore. Or not. So I basically said to him, "Don't read the slides, just help me put it together and stop reading the slides." But I thought that was kind of funny, because that's kind of like what you kind of get. It's like, "Oh, I'm sorry that you have painful sex. I'm sorry that, like, you know, your libido's low. Like, I don't know what else to do about it." There are things that we can do about it, okay? So lower estrogen doesn't mean a change in the libido. And I didn't put in here testosterone, but testosterone also, for both men and women, make a big difference, right? So I sometimes do put some of my women on some testosterone replacement therapy, some cream, and it really changes a lot. But that doesn't mean that the fun has to stop, really. You're going to have to use lubrication, honestly, because even if I was to give you estrogen, again, ovulation, all that stuff has stopped, right? We talk about this I always talk about a biology of sex to my patients, because there is, like, when we are younger and our bodies are made to really get pregnant, I'm sorry, but that's what we were created for, right? There is this monthly, you know, ovulation and this surge that comes because that's what our bodies are made to do. When we go through menopause, estrogen levels plummet to less than 10, which means when we're pregnant, our estrogen levels are in like the 500s. So you're talking about like super, super low. It's going to affect it. So if our bodies are not made to, like, yes, there's a biology of sex to procreate, right? But then there's still that emotional part of it that doesn't go away. So I do have a lot of women that come to me that are like really in tears because they don't know how to kind of fix it. There is a way to fix it, but it's really like, guys, it's really not you. It's really us. It's just, it has to do with our hormones, okay? Because our bodies are just not gearing up anymore for that pregnancy, because we just don't produce eggs anymore. And you guys make sperm all the time, so it doesn't, that's why we have like Billy Joel, the new dad, at like 80 years old or something.
Really?
Yeah, we have all these, yeah, because they always trade us in for a younger model. So, you know, experiment, communicate, and find what works for you and your partner, and really, like, no more pregnancies, you know, or worries. There's a silver lining, right? So there is a silver lining that you don't have to, like, worry about it anymore. But, like, I don't, you know, this is funny. Like, I don't think you understand how these hormones work. You're going to make me do something that'll end up in the news, because we really are off balanced. Okay, so I think this is the one that he was like, "I can't believe you're talking about this." So we talk a little bit more about low libido and painful sex, and like, what do you need to know? So again, estrogen decline can lead to vaginal dryness and discomfort. What happens is that the tissue literally gets thin, and it dries out, and it's awful, but I mean, again, we can fix this. And so it is uncomfortable, and the elasticity does decrease, right? So regular intimacy can help maintain blood flow and elasticity. Vaginal moisturizers, I mean, I use sometimes some compound pharmacies. I also have some natural stuff that I've used for patients, and also prescription treatments can provide relief, like estradiol cream, etc. Really having open conversations with your partner, because I think so many women that I've seen hundreds and hundreds over the years, they don't know how to have this conversation, and this really does put a wedge in a lot of relationships, and they just don't know how to bring it up, right? And so a lot of them, unfortunately, through the years, I've had women that have gone through and are being intimate with their partners and not enjoying it, having pain, and really, want to avoid or start to avoid it, basically, creating an issue between, their relationship. But, menopause really is a roller coaster, but you do have, I'm hoping to give you some wisdom, some confidence, and really, we don't have to really tolerate anything anymore. It's for no nonsense to survive it. So we really need to embrace the chaos, laugh at the madness, and enjoy the ride, because you're not the only ones that are going through it. And, I said, now, excuse me, I'll have to stand in front of an open freezer. But, this is the whole thing, like, will I use my hormones for good or evil today? Okay? So that's we're not sure which one you're going to get. Like I always tell my kids, I wake up like Mary Poppins, but sometimes end up like Cruella de Vil. It depends upon the day. So that's it. I think I just wanted to make a quick presentation on that, like to just keep it light and fun, because it is a really very important topic. And there's this book here that's called Estrogen Matters. And it was written by an oncologist whose wife actually had breast cancer. And it really debunks all the stuff. I mean, like, listen, I came out of school in 1999 when they were pulling estrogens off the shelf. Okay, my first job, we literally pulled everything off the shelves in the OBGYN practice, threw it in the garbage. The Women's Health Initiative did a very, 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 very poor study. They really did it in all women who were over the age of 60, every woman over the age of 60 has an increased risk of breast cancer. Every woman over 60 has an increased risk of cardiovascular disease. The difference that they got was there was a 0.5% difference between placebo and who the patients were on hormone. That is not statistically significant, like at all. So 6 months afterwards, they recanted the study. And 20-something years later, I am still talking women off the edge to say that estrogen is okay to do, okay? We'll talk a little bit about breast cancer and everything too with it. But this book, he wrote it. It's really like the first couple chapters can be a little bit medical because they talk about research and stuff. But it really talks about what I was saying before about why taking hormones in menopause can improve and lengthen women's lives without raising the risk of breast cancer. So again, I'm going back to longevity, right? I think, I'm a Generation Xer. We really want to feel good, right? We really want to feel good. We want to, I have a 19-year-old daughter, I have a 21-year-old son. I want to hang out with them, and I don't want to be that mom that can't get up and my hip hurts and this whole thing. We want to kind of keep going. And we've got to do things to kind of improve our lifespan. And I really believe for both men and women, I deal with a lot of men that have low T that are not sleeping. We could talk about that too. So hormones for both men and women, they do protect us against cardiovascular disease, right? The people the patients that I see that are not, like their testosterone are not high enough in men, or they're women that have such low estrogen, their cardiovascular health is really compromised. And once you kind of, I always talk about this triangle, and once you balance out your hormones, and this is for both men and women, your hormones, your inflammation, and we could talk a little bit about sure Ashley's touched on the inflammation before, but inflammation and really gut health, this is the triad. If you don't kind of concentrate on this metabolically, you're not going to be okay inside. You're not, right? So there's a lot of also, when you talk about hormones, and again, for both men and women, you got to talk about cortisol, and you got to talk about insulin resistance. Because estrogen being too low causes weight gain. Too high estrogen excess can cause weight gain. And the most common cause of estrogen excess really is progesterone deficiency. And so many women that are in their perimenopausal state are really estrogen in excess and progesterone deficient, because even though we're getting cycles, they are what we call as anovulatory cycles. You're not ovulating. That's why they're sometimes so much heavier, a little bit more irregular. It's kind of like you fill up a cup with water and the cup overflows, like the lining just builds up and it doesn't have any progesterone to kind of shed it. And it goes, I don't know what to do. And you get a cycle. And that's why they're so irregular and they're so heavy, okay? But this book really, like I said, it debunks and it really talks about more of the longevity. And this is why I say, it's really almost malpractice to not discuss this with your patients, right? And when patients are on the fence, and listen, it can be scary when you've listened to a lot of scary things for many, 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 many years. It's starting to come back out again where it's not as scary, okay? And you do feel a lot better with it. The other one is, again, it's kind of like where I took the topic from. It's called the Great Menopause Myth. So it breaks it down. This is very, very easy reading, and it talks about your HPA axis. I mean, this is like a really like right up our alley book. When I talk about cortisol, so your HPA axis is your hypothalamus pituitary adrenal axis, right? And so when your HPA axis is off kilter from inflammation, from hormone disruption, chronic stress. I mean, I could go on and on and on about stuff. That's kind of how we cope, right? So if your HPA axis is really not being supported, you're not going to cope very well. Okay. Inflammation is the driver of a disease, okay? Inflammation equals chronic disease equals us to age. So we're always trying to decrease your inflammation, okay? But cortisol is super important when it comes to your hormones because there is something called a cortisol steal. And cortisol always wants to make more cortisol. So this is for both men and women, okay? So cortisol shoots up. It can take pregnenolone, which is the precursor to both testosterone and estrogen. That's how we make it, okay? So we both have the same precursors. It just depends upon if you're a male or if you're a female, which way the pathways go down. But cortisol steals pregnenolone to make more cortisol. So when I actually tell someone who's trying to get pregnant to try to decrease their stress levels, I mean it for a reason, because that will steal away from their hormones, and that can be a big reason for sometimes unexplained infertility. But cortisol is always going to take pregnenolone away from testosterone, away from estrogen. So we want to kind of control that, okay? And then what happens with cortisol is that when it shoots up, it also is super bossy, so it takes glucose with them, okay? So if you have to go fight that saber-toothed tiger, and I have this little joke I say a lot of times, our bodies have not realized that we're not cavemen anymore, okay? When our cortisol goes up, it doesn't realize that we have a refrigerator here, we're not gonna starve, nothing's gonna happen, we don't have to hunt and gather for anything, but our bodies still have that primordial response. So it holds fat on us when we're constantly in a stressful event, because it shoots the glucose up to give the brain energy to fight. And then what happens is the body goes, oh my God, the sugars are too high. And the pancreas has to release insulin. And every time it releases insulin, you're getting these spikes, these up and down spikes, right? And this creates the cells to become insulin resistance. Okay, there is more of a problem in our healthcare system with insulin resistance than it is with diabetes, and I see it all the time. Okay, so we need to always address that internal inflammation, which comes from your gut health, it comes from the foods that we eat, and environmental factors. Those are the three causes. I mean, I talk about environmental as illnesses too, but those are the three factors, and there are things that we can control pretty much on our own, okay? But that cortisol level going up, it's adding to why we're not losing weight, right? So you have to balance out that hormones, like I said before, estrogen too low, and the same thing goes with testosterone. Any hormone that's too low is gonna cause weight gain. Any hormone that's too high is gonna do it. We have to get it like just right, like Goldilocks and the Three Bears. We have to kind of balance it out. And so when I talk about hormone therapy, we're optimizing it. This is not my grandmother's hormones. We're not talking about synthetic hormones. We're not talking about the Premerins, the Prempros, the pharmaceutical stuff, the medroxyprogesterones, which did have an increase in cardiovascular disease, in clotting factors, and sometimes just for some patients, breast cancer. These are more bioidentical. They're plant-based sterols, and when I talk about optimizing hormones, we're actually really checking them. We're not just slamming somebody on hormones and like they used to 20 years ago and say, be on it till you die. It's really checking it and making sure they're optimized. So I never keep an estrogen below 20 because below 20 is not doing anything for us. And I never keep an estrogen higher than 75, right? So we're keeping these levels very tight, not even close to what they were when we were pregnant. So again, I know the myth is always about that these cause cancer. Yes, women have estrogen receptors on their breast. Yes, we have progesterone receptors on it. Yes, we want to make sure that there's a mammogram that's negative, but I'm keeping these levels at such a lower dose than what we were when we were pregnant or when we were in adolescence. And if estrogen truly, truly, truly caused cancer, we would have been riddled with it years ago. Okay, so it's about, and we can talk about it another time, it's really about how your body detoxes the estrogens, and that's a whole nother topic, I think, for another time.
Yeah, we went through the detox pathways and just the order of operations and how to...
Yeah, so did you talk about like the MTHFR and the methyl? I mean, I could go, do you want me to go?
Well, does anybody have any questions at this point? Oh, yeah, all right.
Go ahead.
Maybe you can give her a little bit of context.
I'll try to keep it. I may have to go to your office, it's a lot, but in a nutshell, I was diagnosed with estrogen positive, progesterone positive, HER2 negative breast cancer. I am currently in my second dose of Lupron, and the plan is, if I agree to it, because I just want to jump ship at this point, I'm 40, to put me on a hormone blocker.
Like a tamoxifen, yeah.
Everything, and that's tamoxifen, is another one.
Okay, I can't remember. There's all these different new ones, yeah.
I do not sleep.
Okay.
2 o'clock, I'm wide awake. And I am cranky, got the brain fog, my joints hurt, I'm still going to the gym, I'm pushing through because that keeps me mentally sane. If I don't go to the gym, I am not functional. With that being said, I feel like crap. I was not going to come. Like, I have severe brain fog to the point that it's a struggle for me to even have a conversation sometimes.
So, I mean, you're a little bit complicated, but I'm going to tell you one thing about it, though, and this is me getting a little further. There is a test called a Dutch test, okay, it's called a dried urine comprehensive test. Your regular doctor is not going to have any clue of what this test is, okay? So I will tell you one thing. Your hormones, except when you're in menopause, your hormones, like when you're cycling, they change every day, every hour, every minute, okay? So when you take a blood sample of hormones, it's a snapshot, and this goes for men too, of what's going on in that time frame. When you use the Dutch test, okay, this is more of a functional medicine approach. You're looking at the pathways in which your body is metabolizing these hormones and which pathway they're going down. And I'm just gonna give you a quick overview, especially with estrogen, because this seems to be a topic. So one thing, estrogen receptor positive and progesterones, I don't want to say any cancer is good, but we want breast cancers to be that way because they respond very, very well to treatment. The ones that are negative are not good ones. Those are very aggressive cancers because there's a lot of treatments that they can't do. Okay, so they use hormone blockers for that type. So if it's like I say, it's not a good. Nothing is good, but that is the better type, I guess. In the Dutch test, when you're looking at estrogen exactly, there's 3 different pathways that estrogen can be metabolized down, okay? And we're talking about the detoxification pathway. It's called your phase 1 detoxification. You have your 4-OH pathway, you have your 16-OH pathway, and you have your 2-OH pathway. We always want all of the estrogen to go down the 2H pathway. That is the most protective pathway, okay? That goes into your bones, that goes into your heart, it helps the brain, okay? I can shift things to go down that pathway by giving certain supplementations. There's certain things that kind of help pick up that estrogen and move it down to that pathway. When I get patients that have had a history of breast cancer, I like doing this test on them because I show them that it's the way their body's detoxified is why they developed a cancer. If you move your estrogens down a 4OH pathway, that causes DNA damage. And that creates, so when people go like, I don't understand why this person got cancer, if you look at it, you can see it.
So I'm not detoxing properly?
No, most likely not. And I've had women who were breast cancer survivors, not on hormone replacement therapy, do a Dutch test for me, and I've showed them, clear as a day, that they were moving it down the 4OH pathway. So there's things that you could do, like there's DIM detox, there's calcium glutarate, like there's things that you could do to shift that because you want that molecule to be picked up. Because basically, I know Ashley talked about it a little bit last week, when you detoxify something, you have to methylate it so that it becomes water soluble, so that your liver and your kidneys can get it out of your body, okay? And so many patients do not, again, I'm trying to change. I think what I practice is really fusion medicine because I do fuse both conventional medicine and functional medicine together, right? So I can't, like you come in, I don't know, with an ear infection, I'm not gonna not give, or your blood pressure's really high, I've gotta kind of treat that, but then I'm gonna kind of work to figure out why, okay? So when you methylate something, everybody should be taking tested for this MTHFR gene, right? And we call it methotetrahydrofolic acid deficiency. It's an enzyme. We call it the motherfucker gene. I'm just going to say it because it's MTHFR. MTHFR. And I'm going to tell you, in all the years, 25 years experience I've had in women's health, I have given folic acid more times than none for pregnant women, and it's never been a methylated folic acid until I learned functional medicine, okay? There's a big difference between folic acid and something being methylated because if you have one or two of these genes, you are lacking an enzyme that doesn't help your detoxification pathway. And it's simple as giving you B vitamins, methylated B vitamins and methylated folic acid. Like, it's just a deficiency.
It's a deficiency in one of those 5.
Not true. That's why I had breast cancer.
Well, I'm just saying, like if I was to do your Dutch, I could probably see it going down. So what happens is you go to the phase 1, and then the phase 2 is the methylation process. And if estrogen, testosterone, anything like that is not, and this could be a chemical, it could be, anything that your body needs to move it out. Plus, if you're not pooping, now I'm going to get into the whole poop part of it. If you're not pooping. No, but there are so many women that are not. I'm just saying, like, I'm giving you these things. If you're not moving this stuff through, it builds up, right? And so there is something called an estrogen biome in your gut. That is not a good thing to have. You need that because your estrogen is supposed to be used and pretty much excreted, right? So when it hangs out and it's not being detoxified, that's when issues start to happen, okay? So it drives me a little bit nuts that when I had to learn it, I had to take a deeper dive into medicine. It was not what I learned in school. I had to do this all on my own, right? But seeing this, once you see it, you cannot unsee it, okay? So that phase 2, if you have one of these genes that you're lacking, and I didn't know until I started working in functional medicine that I had one of the genes. I take a methylated folic acid every day, and I'll tell you right now, I feel so much better. I myself had autoimmune disease that was very much misdiagnosed by my colleagues. I had to diagnose myself, and that's why I took this dive into doing what I'm doing.
Anybody else have any other questions? Okay.
Can you just repeat the 3 causes of inflammation?
Gut health, food, environment. And gut health, and when I talk about gut health, I don't mean that everyone's got like these horrible guts. 99.9% of the population has leaky gut, and I don't care what you say.
Yeah, we beat that one to death.
You do, okay? And I don't care how many people, like you just said, I go to the bathroom fine, means jack, okay? I bet if I did like inflammatory markers on you, I bet that more than half of this room has inflammation, and none of your primary care doctors have ever checked it before. Okay, and that's what I'm finding. What's happening is as I'm back into the conventional world, I am fusing the two together, but I can't see the fact that you're just checking someone's complete blood count, a metabolic panel, and a lipid panel, and that's all the basic lab that anybody's getting done. Okay, it's like making my head spin, and everybody that sees me, I end up doing a little set of blood work because they're not checking vitamin D levels and they're not checking B levels, and I'm just going to tell you, I can see through your lab work, your iron, your B, and your D, when they are deficient, which means you're not absorbing them. And the reason why you're not absorbing them is because your gut is inflamed. Okay?
Good. My vitamin D is in the 30s. It's supposed to be in the 80s right now.
Well, I like it as a functional medicine practitioner. I like to keep it between 50 and 60 all year round. These lights drain it. The computer lights drain it. Our phone lights drain it. And we just don't get it. Like now we're in the deep, dark, icy tundra. We're just not getting it, right? So it needs to be supplemented. So if you're taking it and it's not being absorbed, they may not have you taking it with K1 and K2. There's just so many different levels to this, like that, again, conventional practitioners are not looking at the reason why. And so, just to kind of sum up the hormones, right? When I talk about this and I talk about cardiovascular health, once women go through menopause, our cardiovascular disease risk factors literally speeds up to that of as a man. February is women's health. It's women's health. It's heart health for Women's Month, and it's real. And it's real because once we lose our estrogen, it's not protecting it. So when you're talking about and the bones too. I can't tell you how many people I've just got back into the conventional world. How many patients I've seen that have not had a bone density and they're 58 years old. Okay, it's literally driving me insane because these are things that are just very much like health maintenance things that you need to do to make sure that you don't end up with a broken femur, hip, or whatever it is, because the morbidity and the mortality of that is super high, right? And the lifespan and stuff like that. So do you guys want to live, to feel good? And I will tell you, at 51, I'll be 52 in June, I probably feel better now than I did in my 30s because I addressed a lot of the issues that were happening, and I was told I was anxious, and I was told I had 3 kids and I just was too stressed out in my job, whatever it is. Yeah, okay, that didn't help anything, but when you go to your physician and you're telling them that you don't feel well every day, it's not okay to not feel okay. So you have to push it. What? Well, I mean, it's true because I have so many people that come in and they've seen a lot of protection. And I am not the best. I'm not saying that I am, but I see things in a totally different light. And it's like that you start talking and I just know exactly what needs to be done. You're a little bit more complicated, but it's okay. We like the special But again, and I'll just touch a little bit upon for men too. So I talked a lot about estrogen, but testosterone, men do go through a menopause, like a menopause, right? Yes, because, well, I'm going to tell you, because a lot of it has to do with sleep, okay? Has to do with sleep because a lot of men do not sleep straight through the night or they get up very early, right?
Because he hears my head right now, that's why.
So when you make your testosterone in the early morning hours. So when you are not getting enough sleep and you're getting up in those early morning hours and you're not making it, you're just not making it.
I think you just saved my marriage right there.
Well, they need to sleep longer, right? Well, they need to. No. You're misconstruing what I'm saying. I'm saying is that they can't get up at 3 or 4 or 5 o'clock in the morning. I mean, my dad is 75. The dude sleeps 4 hours from 11 to 4 a.m. and then he's awake, right? And he can't go back to sleep and then he's napping in the afternoon. I'm saying that they're sleeping 4-hour stints And they're not, and it gets progressively. And so you have to, again, fix one of the pillars of health, and that's sleep, right? So like I'm not throwing guys on testosterone, because once you get a guy on testosterone, you don't come off of it. So what I want to do is kind of like address the root cause of it, get sleeping. I mean, sometimes zinc supplements will kind of help that. Sometimes we check estrogen levels on men, and they have high estrogen levels, right? And they have a midsection, and estrogen is stored in fat. So, and if you're not, again, detoxing estrogen.
Glutathione.
Yes, glutathione. Yes.
What about when people go to the bathroom and they, when they should be sleeping, like 3 or 4 times?
Like
my
urinating?
Both my parents, they go to the bathroom 3 or 4 times during the night at time. I've stayed over their house and they're always in the bathroom.
Well, a lot of that has, if they're older, like I'll be honest with you, they're probably drinking before they go. I mean, there's like a lot of factors there. There are a lot of women that will also talk about that too. Incontinence is a big thing with women as we get older, like a stress incontinence or an urge incontinence, again, because of the vaginal tissues.
I wake up at 2 to use the bathroom.
Yeah.
Always. It's annoying.
Well, there's another thing too. Like I've been at work all day. Now I'm standing here. I'm sure that I have a little swelling in my legs. I will go home, and when you lay down and you get off your feet, that your heart starts pumping things back up, and then you have to like, so if you've drank something and then you've got some, and this happens with a lot of older people too, they're a little swollen, they go to bed, and then the fluid has to come off of them, and it's coming off when you're laying down.
So it has nothing to do with hormones?
I mean, again, these are very specific things, not necessarily, but for some women, it can. Like urgency with urine, I see a lot of like in the practice, I see a lot of women in their 60s or above that have a lot of recurrent UTIs, that have a lot of recurrent, where they think it's a vaginal infection, and it's not. It's because of the tissue, right? And so, you have to kind of address the vaginal tissue, the vaginal health, and again, it always stems back to the lack of hormones.
The midsection, what does that happen?
Too low of estrogen, too high of estrogen. So again, like it would be like a workup, and once you balance like that, when I was talking about that triangle, once you balance out inflammation, because inflammation is also driving cortisol, and cortisol holds on fat on us, right? So it's not just as like, it's not black and white. This is what I say, this is probably why I like women's health so much, because I'm a whole lot of gray, and this is like a lot of gray. Like every woman's period is different, pregnancies are different, the way they go through menopause is different. So it's very hard to kind of give this like generalization of what's going on, because it's really personalized and individualized care. So when I have a patient in front of me, I'm gonna listen to what's going on with them. I'm not gonna just put a broad blanket statement on some of them might need this, some of them might need that. You might have to tweak this, so I need to tweak that. DHEA is another hormone that I didn't talk about. And DHEA, it is for both men and women. It's an androgen. So an androgen is a male hormone. So men and women have the same things. Like you guys just don't have progesterone. If you do, it's actually a problem. But I won't talk about that. DHEA is a precursor. It's the cousin to testosterone. And DHEA is made by the adrenal glands, again with cortisol. And when cortisol is so high, DHEA can be very, very low. You could see the stress axis. And DHEA can cause insomnia, DHEA can cause fatigue, DHEA can cause brain fog, DHEA can cause loss of libido. I mean, low DHEA, yeah. So all of those things are, but if you don't have the precursor, so sometimes I just give men DHEA. DIE is like, that's the different part of testosterone. That's getting too much into the weeds with that. We have like the the testosterone.
I know where that one goes. I believe you.
But DHEA is another, so I'm always looking at estrogens, progesterones, DHEA, and testosterone, okay? And
Opposite fix.
yeah.
Okay.
And like even for you, like, and as I'm thinking, I would check your testosterone level. And testosterone is also brain fog. Testosterone is also...
My testosterone level, because I honestly am always trying to like fight something.
Well, you're saying that anecdotally, but you may not. And the fact that your hormones, the fact that you're in a premature menopause, like now, is probably why you want to fight everybody. Okay? So it's not necessarily you have a high testosterone. Most women that go through menopause actually have a very low testosterone.
So, like, I've kind of done a little research about mammograms and stuff like that, and I know that Bio does what, do you have a take on that? Do you guys?
I mean, there's the thermography and stuff like that. Like, I'm going to be honest with you. I'm still of the very conventional way that mammograms, there's nothing that, I have seen too many things be picked up very early that if it wasn't done as a screening with a mammogram, that patient probably would have had a stage 4 cancer. I've picked up stage 0s at 40. I still go every year and a half, 2 years, and I get a mammogram. So thermography and stuff like that is just not covered by insurance. So a lot of that, there is that problem with that, and it's not. You have to look at something that's sensitivity. That has to be sensitive and specific, and thermography still is not 100% sensitive or specific for anything. So if there is an abnormal thermography, you'd have to get a mammogram to see what's going on, and probably an ultrasound with it. And I honestly, like, before I would start anybody on hormone replacement therapy, honestly, you would do blood work first. And I really have a rule that I do, whether it's thermography or a mammogram, because of our estrogen and progesterone receptors, I'm not going to give you something if there, God forbid, there was a mass that was there. That's the only caveat to it.
I know they use natural supplements.
Yeah, so yeah, they do. And there are, like, I actually like the natural supplement that I like is something called beeswax. It's actually made with beeswax. It's BEZWECKEN. I use Fullscript as my supplement store because I trust them. Yeah, so it's a practitioner store, so like I have to like invite a patient to it. But you can get the beeswax on Amazon, but I just don't trust the stuff on it. Like, well, there are glycerin suppositories, there's stuff for external, stuff like that. If someone doesn't want to do hormonal stuff, because the Bonafide it's a non-hormonal treatment, for vaginal dryness and stuff like that. I'll tell a little bit of a funny story is that I worked in town for over 16 years with Dr. Sussman, and before the hospitals all took us over, our old office manager used to come and see me, and she's now way into her 70s. And I used to say to her, Elise, like, I don't understand, like, how, she was probably seeing me in her 60s. I'm like, you don't have any issues, like, and she's like, beeswax. And I was like, what are you talking about? This is like my first introduction.
Spell that.
It's BEZWECKEN. ECKEN. So she used to always see me every year, and then I still saw her like in her 70s, and I was like, Elise, like, how is your, and this is kind of gross, but how is your vagina still like that of like a 30-year-old? And she's like, you didn't want to listen to me. She goes, this is the stuff. So I have recommended to a lot of women who have like basically thanked me for it. So not to take away from your company, it's just, this is like a natural, like I've known, it's been around for a really, really long time. It's natural, it's me with beeswax. So again, if you look at someone's like diurnal pattern, which is your pattern of what happens of cortisol, we need cortisol. Like, cortisol is not a bad thing. Cortisol keeps us going. Cortisol's keeping me going right now, right? But when you get up in the morning, your cortisol is supposed to kind of rise, and around 7 a.m. it's supposed to be at the top, at the peak, and then it starts to kind of slowly go down this way, and then it goes off, where melatonin picks up the baton, so you fall asleep. If you have trouble falling asleep, the chances are is that your diurnal pattern is not okay, and you might be like going up and going down, and then your cortisol could be going back up again. Again, these are the things like the Dutch test looks at not just the hormones, but it looks at the cortisol curves, your diurnal pattern. And the only way, and that looks at it over a 12-hour period. So it's not a snapshot of what's going on in just a morning or whatever it is. So if someone's having trouble falling asleep, it's usually melatonin is very low, or their cortisol level is high, because then you could take all the melatonin in the world, and if cortisol is high, it's going to like pretty much bully it down and push it down. So most women, like when you ask about sleep issues, we rarely have trouble falling asleep because we are really, really tired. It's the staying asleep. Like our head hits the pillow, and it's the 2 to 4 a.m. period. I'm telling you, it's like I hear it left and right over and over again. But there's definitely things, and even like I said, the joint pain, the stomach issues, there's a lot of different things. There could be like itching for no reason. You could have like a rash on your face. Like all of these things are all really hormonal related. And unless you really go to somebody that really understands it and they're going to kind of listen, you're going to get kind of like, it's going to get kind of like overlooked. Yeah. And that's very unfortunate. It's very unfortunate. Do you guys have any questions? I know this was kind of a chick thing, but I'm just going to tell you, it's really not our fault.
Oh,
and it's not that we don't. Well, we may sometimes not like you, but
Okay.
you may not like us either, so it's fine.
I have a question. If you pay attention to your inflammation, if you are cognizant of your lifestyle, if you use preventative medicine and you're aware of all of this stuff, what does menopause look like for you opposed to somebody who's more standard American living?
I'm going to give myself an example because I worked really hard for the last 3 years to balance my hormones, get my inflammation down, and fix my gut health, okay? Because I was not in a very good place, probably right around COVID. I would come home from work like literally in tears because I was so tired, but it was not just a tired like, oh, I'm tired, I had a long day. Like it was an overwhelmingly tired. Like take a shower, I could have climbed back into bed. Hip pain, joint pain. I had surgery on my foot, saw a colleague of mine, told me I was stressed, told me I had anxiety. I had a lot of lower extremity swelling and nobody addressed it. Told me I had venous insufficiency. I had 3 surgeries that didn't do anything. Finally did some blood work on myself, and I ended up having rheumatoid arthritis. Now, I'm going to go into a little bit about autoimmune stuff. It's an autoimmune disease. Autoimmunity comes from genetic factors. It comes from, again, we're going to talk about environmental factors, but 90% of it comes from your gut. And nobody ever, when I was younger, just told me that all my gut issues was just because my mother and my grandmother had the same issues, okay? So you just kind of like linked into a family history, but nobody fixes it. So I'm just going to talk a little bit about gut health because that's another huge thing that a topic that I really address. Migraine headaches, chronic fatigue, acne. Kids that have acne, do not put them on Accutane. Address their gut health, their food, like all that stuff, right? So as I joke around, like I was in college, like in the 90s, I was a Diet Coke freak. I lived on Diet Coke and saltine crackers. That's what I got through school. Do you know what that does to your gut lining? It is created, so like as I always talk about, like your gut lining is supposed to be these junctions, they're supposed to be super tight like this, right? And all through the years, antibiotics, stress, preservatives, the Diet Coke I drank, alcohol, glyphosate, all these things now loosen it. So when I talk about a leaky gut, this is what you're talking about. This creates inflammation in your body. The stuff that's inside your gut is supposed to stay in your gut. So when you talk about an imbalance or you feel bloated or you're this or that, you can take all the probiotics you want in your life. You're never going to get better if you don't tighten those junctions. So I took over my health, and that's how I dove into functional medicine. It was a marathon, not a race. It does not happen overnight. I was probably 40 pounds overweight, but I was like that puffiness. Like 2 years ago, my daughter just looked at a picture. She goes, Mom, like you were chubby. But it was like this cortisol face. It wasn't me, right? So I had to address my food. I worked a lot on gut healing, on restoring my gut health, and balancing out my hormones. 2 years ago, when I checked my hormones, I thought I was going through 100%, that I would have like no estrogen. I was actually that estrogen excess patient, that my estrogen was in the 300s and my progesterone was 0. That's a major, major imbalance, right? Still getting periods, still kind of thinking that, but that creates this whole midsection, that and the cortisol, I was insulin resistant, everything. My inflammatory markers, you look at something called a high sensitivity C-reactive protein, was the highest, you want it to be under 1, it goes up to like 10, mine was like in the 8s. It was really elevated. Now I haven't checked it in a year and I have to do my labs, but I went down from just doing what I'm telling you to do. I dropped 40 pounds. I'm not going to say that my hip doesn't hurt from standing on my heels all day, but I don't have any more joint pain. I don't have any more swelling in my lower extremities. I can fit my rings on. I couldn't fit them on. I've gone down 3 sizes. And when I say to you, I don't even know what time it is. I have been going nonstop since 7:45 this morning, and I feel amazing. Okay.
So, she's actually asking for me. So, when you are a woman of a certain age.
You can still do it. I have put women.
No, but
okay.
Listen, what I'm saying, is it a good thing that you don't have the issues that your friends have who are either your age or younger? Because I don't have those.
It's good, but the thing is that you got to remember what I said in the beginning. Longevity, longevity, longevity. So I don't know what your cardiovascular health looks like. I don't know what your bone density looks like. You're talking about preventing illness.
Yes.
Okay.
I'm also talking about the stuff you were talking about with the progesterone and dryness, things like that.
You don't have to have those issues, and I can probably get your labs and you are deficient, right? So there is a part of it that some people, because they are so healthy, that their hormones have been okay and you didn't go through such a trip. There are women that completely have no problems like that, right?
You're a unicorn.
But I say that there are some...
I've called it an anomaly before.
Anomaly, but I do have people like that like I saw one like every year and all of a sudden they just like never got another period and never complained to me ever again, right? But then you're looking at it like a longevity purposes, okay? And there are estrogen stores that sometimes are just like you haven't come down from them yet, right? At some point they will bottom out.
Well, because
Okay.
I started hot flashes in my 30s.
Yeah, so you probably had some premature, so that's another thing I want to say is like if you haven't even gone through menopause, the misconception is that you're going to treat once you're 1 year postmenopausal, okay? Little TMI, but I still get a period. It may not be 100% regular. I have been on hormone replacement therapy for 2 years, okay? The new theory is not to wait for you to go on it because of the benefits of cardiovascular health, the bone health, your brain health, right? There are studies that have shown that. And I have had women that come to me that couldn't remember anything, that was really like, they thought they had ADD, whatever. I'm like, please try 2 weeks of estrogen, come back to me, and because they were coming in and asking me for ADD meds. And I'm like, let's address the root cause, okay, and not just the Band-Aid. A lot of people, not the people in this room, but there are a lot of patients that come in and they think that a Band-Aid's gonna fix it. It's not. So you don't have to have it, but like, I would...
I'm curious if that was another thing that could be a concern, or is it something that's actually a good thing?
It could be a good thing, but you don't know what's going on, like unless you have things checked, what's going on metabolically. That's kind of what I'm saying. So you feel fine, but sometimes what's going on, the changes inside, may not be what you feel reflect. And the same thing goes too, I talk about healing from within. So when you heal from within, that's when your cortisol levels come back down. You start to lose weight. Metabolically, your insulin resistance gets better. I see changes in, like, we look at cholesterol levels. And one thing I want to talk about, I know I'm going a little off topic, is that, again, in functional medicine, we look at a deeper dive into things. Cholesterol is a big thing, okay? Statins are horrible, okay? And every conventional doc's gonna wanna put you on a statin because they get nervous, okay? There are things that we can do. There's something called a calcium CT score that we could see if there's any buildup in the arteries.
Statins. From inflammation.
It comes from inflammation. So your low density lipids, which is the bad cholesterol, can sometimes be elevated. And they're elevated because they're part of the immune system, and they're elevated because of inflammation, okay? So many docs, and I just had a mail the other day that put just a 42-year-old guy, super built, super great, has erectile dysfunction, has no libido, coming in like in tears, spent $25,000 on counseling with his wife. He's on a freaking statin, and one of the causes of statins is erectile dysfunction. Lipitor, atorvastatin, cholesterol meds.
Your hormones are made out of cholesterol. Your brain.
So that's what I was going to say. So, like, I get these guys that come in and have a cholesterol of 120. Okay, that's ridiculous.
Wow.
It's low. It's too low. You're not going to make testosterone. You're not going to make your hormones if it's that low. So statins don't clear cholesterol. They harden the soft plaques. That's all they do. So that could be another talk for another time, but I'm just saying, like, that is related to hormones because a lot of men, and it's actually not protecting your heart. It's actually working against you.
There's also genetics where high cholesterol from our family. We're from Calabria, southern Italy, and everybody naturally.
But there's also something called epigenetics, and that's something we can get into at another time. It's just because it's in the family history doesn't mean that you're going to get it, and a lot of it also has to do with environment, like we talk about environmental factors.
So that Capricorn.
Well, it is, but honestly, in Italy. But listen, I'm from northern, like my maiden name is Sorrentino, so from Sorrento. My grandparents lived until they were in their freaking 90s, okay? They did not.
It's more natural because that part of Italy there is.
It is, but what I'm saying is that when you compare Italy to us,
They're much
Night and
more.
day.
or to our grandparents to us, they ate, we didn't buy, my grandmother did not buy food, tomatoes in Costco, okay? Put it that way. My grandmother went to the market, she bought stuff for 2 days, they cooked what their food was, they ate it, and then they went back. No, because I've been home all day. Like we have gotten into a very busy American world. So when I look at like my aunt, like, yeah, my grandfather had high cholesterol, but you have to look at the breakdown. It's not just about the total number, you have to look at the breakdown. So a lot of people have high cholesterol, but they have an HDL, which is your happy cholesterol, of 85 or 100, which is amazing, right? So you have to look at the whole, you have to break it down and look at it and not just say, oh, your total cholesterol is 255. Okay, well, what's the breakdown?
There's different types of LDL, like
Triglycerides and,
really is,
yeah.
It's does not have a good reputation whatsoever. It's protective. You need it. You need it. It cleans up your body. Like it's important.
But those are the things that I'm talking about. So the inflammation sometimes raises the cholesterol, and no one's telling you about that part of it, right?
Cholesterol acts as like a Band-Aid. So if your arteries are inflamed, cholesterol is going to show up to try and mitigate the problem. So you think that you have high cholesterol, you have cholesterol in your veins. Oh, that's a bad thing. We need to get rid of the cholesterol. No, the cholesterol is just showing up as a first responder to get the inflammation down. So the root is the inflammation.
I can tell sometimes by someone's labs who I've been monitoring, and I'll be like, Joe, like, why is were you sick? Like, what happened? What was going on? Because they've had normal cholesterols and all of a sudden a big spike up. And he goes, oh, yeah, I had COVID or I had this or that. And then like 6 or 8 weeks later, I test it and they're completely down. You're seeing the immune response happening. So it's just breaking it down. This is, when I went back and I kind of did a lot of studies by myself, it's like learning everything that you didn't learn in medical school. It really is.
And it's a holistic approach, which is a whole body
The whole body approach.
As opposed to Western medicine that keeps things individualized.
It's really, Western medicine, unfortunately, has become sick care. It's become very much, as you could see, like the pharmaceutical companies, the insurance companies. It is. Like, we are never going to get diabetes cured because it makes so much money.
Well, and the big food industry.
Do you know if that whole thing with vitamin K2, if it's supposed to help keep cholesterol doing what it's supposed to do?
Well, I usually give, when I do vitamin D, I'm just going to tell you, I use a product called Vitamin D Supreme from Designs by Health. It's got K1 and K2 in it because a lot of people are taking vitamin D and it's not getting into the cells. So that helps get, and so a lot of times the vitamin Ds are really, really low, and that's causing the cardiovascular stuff. So it helps kind of like work on that pathway.
Okay.
I'm taking it now, the D with the K2.
Yeah, you have to do it, otherwise it doesn't get into the cells. And so like, a lot of conventional meds, they'll give them 50,000 international units a week. It doesn't do anything. Or you want to get something that's 100% bioavailable, get a vitamin D shot, get a B12 shot, because then you're going to kind of bypass the GI tract and 100% is going to get absorbed.
What do you mean shot?
Like an injection, we give injections, like a vitamin D injection, because when your gut health is so inflamed, you just don't absorb your nutrients, right? So when I talk about supplements, right? When I talk about supplements are just to bridge the gap to what we're not getting. No, I don't want people living on supplements, but I talk about B, D, and methylated folic are the three major ones that you probably should always be taking if you're deficient in it, because even though your D might go up, it plummets all the time.
So somebody that has a genetic blood and someone that has a body disorder among women. So when you talk about estrogen, I've always been told that stay away from that.
It depends upon what clotting factor you have.
AT3.
Only if someone has a protein S or it's a deficiency. If you have a deficiency, like a protein C or a protein S deficiency, that's linked to estrogen. This is, again, hematologists and people like that. I mean, again, you're a little complicated. I have to kind of take a look at the lab work and everything else. You're talking about, again, when you talk about the estrogens, those were synthetic estrogens that were used that created the blood clots. When I talk about that, it's our grandmother's stuff, the Premarin, the Prempro. These are the conjugated estrogens that were made by horse urine. These are plant-based sterols, estradiol, and there are lower risk factors with it, and I usually use a patch, which actually decreases the side effect of any sort of blood clots with it. And you're always supposed to use a lower dose with it. And if you're already on Coumadin, the chances of you developing a clot is very low. Right? So patients are on Eliquis, Coumadin, Lovenox. I mean, you're doing that because you have but it would be the same thing. Do you have children?
Yeah, I have one.
Okay, so estrogen is the estrogen state that you had when you were pregnant was way higher than what your estrogen state would be here. Yeah, but I'm just saying that was a way higher. It's a way higher level
than what you would be on if you were doing hormone replacement therapy.
Right. Because I had a 96% chance of having blood clot when pregnant.
Yeah, so this would be I'm saying I'm keeping levels around 20 or 30. When you're pregnant, you're in the 700s, thousands. I mean, we don't even check estrogens. It's extremely high estrogen state. And you're in and pregnancy, because of the venous compressions and stuff like that, you're in a hypercoagulable state to begin with. Any woman could get a blood clot during pregnancy.
This is good, right?
Yeah.
Any other, it's pretty late, but any other huge questions?
I'm just going to go to your office.
Okay.